Hi, everybody, and welcome to another segment of MedTalk brought to you by Medical Tourism, where we talk to board-certified doctors in Mexico that offer procedures to international patients. Right now, I have as a guest Dr. Gabriel Rosales, bariatric surgeon with over 19 years of experience, and we're talking about the gastric balloon, or how do you pronounce that in English?
Yeah, it's gastric balloon. This topic that we're talking about is specifically the swallowable or ingestible gastric balloon.
We did a whole episode regarding that topic. We're going to leave the link to it. It's in Spanish, but we're going to leave some subtitles for you guys. If I'm a candidate, can I start the whole process online to see if I'm a candidate to have that procedure done?
Yes, you can have a virtual appointment with us, and we can determine, first of all, if you're an actual candidate for the balloon placement. And then we ask the patient to come. We perform all the evaluation prior to the placement, and then the patient can go back home. But of course, we need to keep in close contact with the patient during the whole process. It's a process that takes more or less 4 to 6 months.
After the virtual consultation, if I go and get that procedure, swallow the pill in front of you guys, after that, am I clear to fly, or how long do I have to stay in Piedras Negras before I can get on a plane or go back in a car, drive back home?
Yeah, in theory, you could go back immediately, either by plane or car. But we suggest patients to stay with us at least one night if they're coming from afar, just to make sure that they're going to go home without many symptoms, which are not uncommon in the first 3-4 days after the placement. They require an adaptation process during the week. So we ask just a few hours with us just to make sure they're going home feeling good.
Is it a surgery or is it a procedure, or do I need a hospital stay?
No, definitely it's not a surgery. Not even, it's of course a procedure, but it might sound like it's just too much. It's a very simple, straightforward placement procedure in which the patient swallows a capsule. It's a kind of big capsule, but it's definitely doable. And we help the patient using a tubing that connects with the balloon. And then through that tubing, whenever we confirm that the capsule is in the stomach, the balloon is insufflated with fluid, approximately 550 milliliters. We confirm its placement, and then that tubing comes out, and we're done. This takes us about 15 minutes in total. No need of anesthesia, sedation, nothing. The patient is completely awake, sitting up, and we need some x-rays for the confirmation of the proper placement before getting it filled up.
After I go back home, will I have any issues at the airport because I have something in the stomach or something like that?
No, it's pretty uncommon. If you get like a body scan in which they use some imaging, yes, the balloon can show up, but we provide the patient with all the necessary information, paperwork that confirms that the patient has an intragastric balloon and nothing else. No.
Okay. And lastly, is the price, can I expect to be lower than in other countries?
Yeah, definitely. Coming from the States, I believe it would be much more accessible pricing, not necessarily because of the product, but just for the rest of the things involved.
Yeah, in general, but it's the same product that they sell in other places.
That's right.
Okay. Thank you very much, Doctor, for your time and for answering those questions. And thank you very much for listening. Don't forget to check our website, Medical Tourism X, where you will find the doctor information, as well as other bariatric surgeons all over the country that offer this type of procedures. Thank you, Doctor.
You're welcome. Take care.